how would you describe the NHS to an Indian who does not know about it? And would you advocate it for the Indian economy? Can we handle a system like NHS?
The NHS is based upon a most powerful social promise, which is that the guarantee by the government is of free healthcare for every citizen at the point of delivery, irrespective of their wealth and to the highest quality in the world. So there is no discrimination between citizens, whether they're rich or poor. Everybody has free healthcare of high standard. Whether that's applicable to India, I think, is more complex because it's taken us many years to work to this position and to work up a healthcare system that extends, from birth to death, but also across the nation with equal provision. India, with its state provision, will always have differences in provision. I think, secondly, the private sector in India is expanding rapidly and is providing state-of-the-art facilities. The public sector is much more varied. It's more advanced in some states, such as this, but in other states it has some way to come. So what is needed, I think, is a continued increase in public investment, but also some market investment in order to provide a world-class system.
Could you expand on the nature of India-UK partnership in the healthcare sector and your agenda of coming to India?
There's a great deal of partnership already between India and the UK in health. There's always been quite a flow of doctors and others between the two countries. So, for example, at the moment in England, we have something like 50,000 physicians of Indian origin working in the UK. So the starting point, I think, is around training, medical education and specialty training in particular. Secondly, around drugs. So 25% of the drugs that are prescribed in England are made in India. This is the great generics market, obviously. But also some of the big British drug companies like GSK have a major presence in India as well. So on drugs. I think thirdly, and where we would like to see more collaborations occurring, are around smart technologies. Prime Minister Modi has announced the proposal for 100 smart cities. We're very keen to be part of that, and using new technologies which range from things like acute sensors that can pick up changes in the body's reaction to different environments, real-time monitoring of the progress of disease, and also trying to understand how we can create living conditions that will better advance human welfare and health. So my purpose in coming to India is to understand what's happening, what is the particular example and particular niche that we could find in working with state and national governments in India, but also with the private sector. How we can pick up on the Make in India proposals and how we can bring together some of our leading manufacturing and services industries in the UK to work more closely with Indian partners. So both countries have huge opportunities in the health sphere, and I think we'll be stronger together than not together.
The amount of funding needed for the NHS to keep progressing is not being provided by the government. So what is the eventual future of a system like NHS?
NHS is currently consuming about 8% of GDP, and the norm in France or Germany would be more like 10 or 11%. I think in India it's more like 4%, but the bulk of that is private rather than public investment. In America it's 17.3% of GDP. But if you look at the outcomes in America are not notably better than anywhere else in the world. So there is not necessarily a clear link between the volume of investment and the quality of outcomes for a population. Our argument at the moment is that to meet an increase in demand which we're seeing in patients, then we need to either have an increase in investment, but the temptation with that is to carry on with business as usual. At the moment, looking through to the year 2020, we figure that the increase in demand is significantly outstripping the increase in likely investment. So we have to do things differently, and this is where innovation comes to the fore. So what are we going to do differently? I think a number of things. One is to focus on changing models of care, removing the rather sharp distinction between primary care, GPs on the one hand and hospitals on the other, and getting a greater combination between the two, so that much of the emphasis comes towards keeping patients out of hospital rather than taking them into hospital. So I think that's a very important way of changing the model of care. Another one is understanding much better what treatments actually work. Because we know, for example, in chemotherapy, in cancers, that a lot of very expensive drugs work only on maybe 30% of the patients to which they're applied. There's a lot of trial and error. So using modern technologies, particularly whole genome sequencing, we know that we can refocus that. So we are quite committed to using the opportunity of austerity to significantly improve the efficiency of the NHS over the next few years. It's difficult to do because people are wedded to ways of doing business, and there are very strong cultural traditions, especially amongst clinicians. But we know that every pound that we save in treatments which are not effective, we can commit to treatments that are.
NHS as a system, from my experience, attempts at standardization, right? But they say that because it's such a huge system, innovation and picking up innovative technology becomes difficult. How would you answer to that?
I think the NHS is hugely innovative. And many of the great innovations in modern medical science have actually come from British universities and the NHS working together. But your criticism is accurate. The problem comes when we try to spread innovation across the system, because we've taken quite a simple concept with the NHS, which is a single payer, which is the government, and a single provider, which is the NHS. But we've then fragmented the provision, so each hospital trust has its own governance model, its own employment, it employs its own staff. The body that I chair is responsible for funding them all, but the initiation of innovation will often occur in one hospital trust but not be picked up by another. This is not acceptable, actually, so I think we have a program of driving innovation across the NHS, and one of the most important things is to stress how we can use innovation and modern technologies to reduce the cost of healthcare. So I think with India we can do two things. One is that we can bring innovative thinking and creativity which comes out of the NHS. But actually, secondly, I think we can learn a great deal from India about how to leapfrog through generations of development of healthcare systems and to use a lot of the technology that's emerging in India to help us to solve some of our problems back in the NHS.
The NHS system, improving the NHS system is being linked to Britain remaining in the EU or not. Could you give your opinion on it? Are the two issues really linked or are they not?
And the referendum's on the 23rd of June. Anybody who tells you they know what the answer will be is lying. Nobody knows what the answer will be. The opinion polls are all over the place. So there are three scenarios. One is a clear majority for staying in the EU, in which case nothing much will change. Another one is a clear majority for coming out of the EU, and that will be very difficult because we don't know what the world will look like as a result. It will take several years to negotiate the trade agreements and the other relationships that we would want, not only with the EU but with the rest of the world. And it's very difficult to forecast what would be the impact on healthcare. The third scenario is that it's really on the edge. The third scenario, and we are very uncertain about that, because it could mean that if there was a thin majority to stay in the EU, that wouldn't be the final answer. It could mean that the government will change, so it's uncertain. But I think two or three things. First of all, we employ within the NHS 130,000 people who are EU citizens outside the UK. So we're very keen that nothing should disrupt our ability to employ the brightest and the best from across Europe. Secondly, research and development and drug manufacture are all European-wide, if not globally wide. And I'm very concerned that nothing should happen that would diminish Britain's opportunities to work closely with global partners in research and development and with drug discovery.